Hello friends, I hope you are doing well. Today we will discuss another very important topic for communication station in MRCPCH clinical examination. Suppose you have been asked to do a counseling a mom who is going to have a preterm delivery. How would you approach? First of all, greet the mom, introduce yourself, define your role and responsibility, ask mom whether she wants anyone to join the discussion or not. And then you ask, what is your idea, concern, understanding about the preterm delivery? It is very important to ask this question because mom may have the previous preterm delivery experience. Then you start your discussion. First, we will receive the baby in live start. This is a special device which will help to do the delayed cord clamp. Then we will take the necessary steps to prevent cooling. We will warm the baby, we will stimulate the baby and observe the baby, how the baby is breathing. If the baby is struggling to breathe, if the color, tone, activity is not good, we will follow our guideline. First, we may need to provide some breathing support by means of mask oxygen, and then we will increase like the positive pressure ventilation and the other necessary steps. If the baby is struggling to breathe, we may have to put down the tube to ventilate the lung, or we may need to give some medication called surfactant to inflate the lung well. Next, we will take the baby in the NICU, and then we will take some blood test to understand how is the oxygen, carbon dioxide, lactate level in the blood. It will help us to decide the fluid resuscitation. Then we need to do some blood test for the infection because the smaller baby don't have much reserve and their immunity is not so good. So we need to start the antibiotic. Then we will observe the baby, how the baby is doing. In the extreme preterm baby, we may need to start IV fluid. Then we may need to start IV nutrition. Later, we will introduce some breast milk or the donor breast milk if the mom's breast milk is not available. Then gradually we will introduce the milk and build up in amount and reduce the IV fluid. The other challenge would be the heart, how the heart is functioning, how the heart rate is going, and any problem with the brain activity or not. In preterm delivery, there is a risk of bleeding inside the brain, but we will scan the brain whether any bleeding is there or not. We will observe the baby for the neurological point of view, and we need to give the vitamin K. Vitamin K has lots of benefits and it will help to prevent the bleeding. There is another discussion sometimes mom wants to have regarding the steroid. The steroid will mature the lung as well as it also help to prevent the interventricular hemorrhage as well as the necrotizing enterocolitis, which is due to the gut immaturity. Try to avoid all this medical jargon, but if you use this jargon, you can explain them in their own way. And after finishing the discussion, always ask for the help and if required, and you can provide the information leaflet. If mom is not satisfied with the discussion, you can bring the consultant to do the discussion. And after finishing, you need to summarize. Today we have discussed your pregnancy. We are expecting a preterm delivery. We have discussed all the concern, all of your fear and all the concern as well all of your questions, and we are going to have the preterm delivery, but we will be there to support you all. I wish all the very best. Thank you.